morning and good afternoon and good evening, ladies and gentlemen. I'm Pallavi and I welcome all of you to the first among the upcoming series of webinars from the Journal of Bariatric Surgery. In this series, we are going to focus on research and publication methodology. It will start from the beginner level for people who are looking to start in academic publishing, and it will go to more advanced level for people who want to graduate into systematic reviews, for people who are looking for global collaborative research platforms. To kickstart the show and our first episode, we have a very high-powered faculty with us. We are going to keep the lectures intense and the moderation brief. Please leave any questions or suggestions that you have in the chat box, and we will have our relevant faculty address those as the time permits. To start the program, I asked Dr. Raman Goyal, the editor of the Journal of Bariatric Surgery, among everything else that he is. Sir, can you please take it from here? I'm not going to attempt to introduce you. You are your introduction enough.
Thank you, Dr. Pallavi, and welcome, friends. It's a great occasion for me because over a period of years since the OSSI got founded, we have been discussing with all the members and our friends overseas, how do we make it a more academic association, of how do we make it a more inclusive association. And there we have the executive committees of OSSI at various levels have taken different steps, which I don't need to enumerate. So when I was asked to take charge of this journal, I was pleasantly surprised. And then I thought that now time has come to take this to another level, the OSSI's academic commitment. So I'll have just a 5-slide introduction, and then we will have the academics going. So give me a second. Pallavi, are you able to see my slides?
Yes, we can see your slide, Dr. Goyal.
Great. So friends, this is how the journal will look like. This is an official publication of Obesity Surgery Society of India. And just like all the journals are. But this journal is going to be an international journal. We have a very experienced editorial board from different parts of the world. And that is one of the reasons why we want this journal not to be localized to India alone. This will be going across the world. When we started discussing this journal, there had been some resistance and some skepticism. Why a new journal when we already have 2 journals which are doing very well? So important thing to realize is that there are increasing bariatric volumes in many parts of the world which do not own a bariatric journal. So Africa, Asia Pacific, and Europe are the areas which do not have a journal. And the very fact that we are asked to review articles from general surgical journals for bariatric shows that these journals are not enough to accommodate most of quality publications that are coming from bariatric surgeons all over the world. So in last 1 year alone, I have probably reviewed 20 articles from Indian Journal of Surgery only, and most of them were very good quality articles. So I think time has come. And one thing has been established that if people feel ownership of a journal, it improves research, and it increases the number of publications. So I hope all these countries, and even North America and Canada, our surgeons from these countries would happily accept this journal, and we should keep the skepticism away, because this is just going to be an addition to our armamentarium in long run. Now, Journal of Bariatric Surgery, or JBS as we call it, will be an open access journal. And so it will be online, all the articles free to access, and authors don't have to pay for publishing articles. The OSSI members and those who are subscribing for it, like libraries and overseas members, would get hard copy. Otherwise, everybody will get a online access. Initially, we have decided, along with Dr. Pradeep Chaube, who is the chief editor, and the president of the society, Dr. Manish Khaitan, and my co-editor, Dr. Kamal Mahaver, that initially we will have 3 issues per year. And then as the number of submissions increase, we can always reconsider the frequency of publication. Now, an important thing that has always been in my mind is the journal is not about just publishing the article. Journal, we can use this platform as we are doing it today and as has been planned alternate months, is to create awareness. To create awareness to create data, to maintain data, to analyze the data, and to share data. So this needs a bit of courage initially among those who are not into publication. They should rise above their insecurities. By sharing data, actually you benefit because of many reasons, which I'll just quickly show you at the end. It is also to create a research environment, and this is what we are doing now, that we'll start from basic research and everything we'll try to handhold you. Only all that we expect from you is participation in these meetings. To encourage evidence-based medicine practice, and ultimate aim is to improve patient care and better outcomes for our patients. So we have a work cut out for us, which includes finances, which includes submission of enough articles, which includes timely publication. Now, each of them is important, but I believe with cooperation of everyone, we should have no problems in managing these. Needless to say, I have support from very experienced editorial board members, OSSI's president, secretary, and all other executive committee members. And we have a quality publisher with a very large number of publications all over the world. And you know them very well in India and in many parts of the world. In India, they are represented by Magno, but worldwide, they are known as Walter Kluwer. And of course, the most important part of a journal are their authors. So all authors who are experienced and those who are not experienced, they can all submit their articles through this link, which can be shared. It's available online. And generally, what I have found among surgeons, because when I was in IGS, is that there's a hesitancy. Is this data good enough to be published? Is this case series good enough to be published? Shed your hesitancy. We have enough time because we still are not flooded with manuscripts. Send us whatever you think you want to publish, and our editorial team will go through it. We will handhold you, and we will make sure that you get the best opinion about publication of the manuscript. On behalf of the editorial board, I can commit that every article, every manuscript will be peer reviewed except the invited editorials or review articles. We will have timely publication because that's so important to get the journal indexed in due course. And we'll do everything so that the journal is indexed early, and so that all those articles which you are sending now will also be retrospectively indexed if and when the journal gets indexed. So friends, we are trying to make JBS a journal that you should be proud of because you own the journal. And to introduce today's topics, in my opinion, data keeping is like seeing yourself in mirror. Unless we manage data, unless we keep data, we don't know where we are going. And that's so important. And publication, when you publish an article, it is showing the mirror to the world that you have done this, and they will see how high you are soaring. So I think with that concluding remark, I would hand over back to Pallavi to start the academics. I welcome our chief editor, Dr. Pradeep Chaubey, sir. Pallavi, I think is a time to get Dr. Chaubey to have his welcome address. I was just filling in.
Yes, absolutely. I think we should have a welcome address by our chief editor, and we'll move forward from there.
Thank you very much, and welcome everyone, and good evening to everybody. And with the great enthusiasm of Dr. Raman and the editorial board, and of course various colleagues, this is a great step. And I just looked at the importance of data, as you said that it is important, Raman, to be mirrored. The only thing is that the mirror should be of a good quality and should reflect exactly what is happening. And we have a really seasoned and very expert and academic group of people, and full of enthusiasm, passion, and dedication for this great job. And I wish all the best. And I'm sure events like this and evenings like this will bring more clarity and also encourage our younger colleagues, because ultimately publication and putting everything scientifically on the journal is what takes us to the academic journey. So welcome all, and Pallavi, please go ahead with our agenda. Thank you so much.
Thank you, sir. Thank you so much for being here. I think we all share your and Dr. Goel's vision for the Journal of Bariatric Surgery, and we are looking forward to the great upcoming success of this journal. Without further ado, for the first lecture, we have Dr. Asim Shabir from Singapore. He is a senior consultant in the division of upper GI surgery at National University Hospital and an assistant professor at the National University of Singapore. I have had the privilege of listening to him earlier, and I'm sure we could not have had anyone better to start the program. So here is the first lecture from Dr. Shabir on finding a research questions. Any questions or comments, please leave them in the chat box, and we'll take it from there after his lecture is over.
Dr. Asim?
Yeah, just one sec. Yeah, I'm just sharing the video.
Pradeep, I recorded it for them. They're going to play it. So how are you?
Right. Okay.
Pallavi, there's no sound. I think you'll have to go in the sound settings of Zoom.
Yeah, I'll just check.
Thank you very much. I would like to thank
Do we have the sound now?
Yes.
Berna and her team for the kind invitation to give this talk. I would like to congratulate Raman Goel and my good friend Kamal Mahaver on the launch of OSSI's journal of its own, Journal of Bariatric Surgery. Congratulations, Professor Pradeep Chaube and all my colleagues in India. I have been tasked and honored to talk on this first session on what constitutes a research question. I am Asim Shabir from the National University Hospital in Singapore. Now, let's have a look at the problem. Is it an interesting problem? Are we curious about what we are doing? Then it is interesting. Then we are progressive, and then we make a change. But we need to be curious to answer the where, what, why, and how. And this is called research. And this ultimately improves care and provides us with a sense of success. The great man Albert Einstein himself said, "I have no special talent. I'm only passionately curious about what I do." And that's what, in my opinion, research is. What is a research question? Before we embark on a journey, we have a strategy for a journey. The first step in that strategy, in my opinion, is to formulate what is called a research question, which is actually a statement that identifies the phenomena that we wish to study. There are attributes of it, which you can see here, and we will discuss later. It is challenging to see if determining which clinical uncertainties or unanswered questions could be studied, and also rationalizing the need for their investigation. What are the elements of a good research question? It should be specific to the population of interest. In your case, in my case, Singaporean population, Asian population, bariatric population. It should be of interest to the scientific committee who are going to read your work, scientific community who reads it. If you're going to do some public-based research, then it should be of interest to the public. It should have a clinical relevance. It should make sense. It should further the knowledge that is available, and obviously compliant to ethical and national research standards. The first step in formulating a question is to know your literature, know the topic, know the working knowledge, know what has been done and how you can make a difference in doing what you're going to do. There is a very fine line between current knowledge and ignorance. I've put up a simple flow chart. I ask myself, do I have a question to ask? Or do I not have a question to ask? If I have a question to ask, I would review my literature, formulate my research question, and I'm done with my first step. If I do not have a question to ask, I would rather narrow down to a topic. Let's see. I do not have a question. I do not know what to do. Let's see. You narrow down a topic, think about it. I've put an example. Bariatric surgery is something I want to study. In bariatric surgery, I'm interested now in studying one anastomosis gastric bypass. In one anastomosis gastric bypass, I'm more interested in studying the outcomes. In outcomes, I'm more interested in studying the reflux outcomes. So what the research question has to be that it has not been addressed before, or if you're going to add on knowledge, it should be significant, or it should be a totally new era of discussion, like what is the impact of different bypass limb lengths in OAGB on weight loss, metabolic, and nutrient outcomes following OAGB? Maybe a question. When you do literature review, read as much as you can. Read relevant papers. Read publications. Read up-to-date information. The more you read, the easier your research question gets. The second scenario is, oh, I have a research question. Then review the literature, because if you review the literature, you would see whether the question that you have has already been answered. Is it potentially a valid one? Or how could you tweak your research question into a brand new question? Do not make the mistake of going and doing a literature review at the end of your research project, because that's when you write the discussion and you only to find out that, oh, this work has already been done and reported and I bring no contribution. Suddenly, from an impact factor of 42, you fall down to an impact factor of 0. Okay? Where do you look for this? There's a lot of electronic media, PubMed, Ovid, Cochrane, in-depth reviews. If you're going to do a population-based, speak to patients, a very good area to start is also to speak to your senior colleagues, to experts in the field. What do you think about this? What are the current trends? And look at technological advances. Let's see what knowledge is. Knowledge is power. It helps you generate a number of questions. Ask yourself whether you're going to answer all these questions from your literature review in one study, so could you do more? And as you go along reading, you will have more and more questions coming up which you can keep and answer in future studies. There are basic principles in formulating questions. There are primary questions that you want to answer, and there are secondary questions, which are the secondary endpoints, as we call, should be developed at the beginning of the study. The secondary endpoint should not compromise the primary endpoint. So my primary endpoint is weight loss, but I've done surveys. I should not put in 50 surveys so that the patient refuses to come for my follow-up and I lose my primary endpoint, which was weight loss as well. The primary research question then would form the basis of your hypothesis. What are you proposing? And it will then help you come through what your study objectives are. If the number of primary questions are more, it will add to the complexity of the study design, subsequent statistical analysis, and actual feasibility of answering every question. Right? So if you want to study quality of life, you want to study quality of feeding, and many more qualities, and the question is 100, it becomes difficult to answer and design the study. So what's a sensible strategy? When you pen a question, pen a question, a single primary research question around which to focus the study plan. In a study, the primary questions should be clearly stated. It should be specific to a population. Intervention to be implemented should be clear. Other circumstantial factors need to be mentioned. You can use the Finner's criteria, which I've listed out here, which was published way back in 2007, and it outlines the important aspects of the question in general. Finner stands for basically feasibility, interesting, novel, ethical, and relevant. That's what are the attributes of your question that you're looking for. Feasible, you cannot recruit 1 million patients. You cannot spend $100 million on doing mortality study. That's not feasible. So it should be feasible in financial and recruitment sense. It should be interesting, novel, ethical, and relevant. We've already gone through. If you want to use a format, I will recommend the Pico format to develop a research question. Ask the following things in your Pico criteria. Which population, what special population am I going to study? What intervention am I going to do? Who is going to be my comparison group? What outcomes of interest do I wish to accomplish? And in what period of time do I think can I assess the outcomes and the study can be completed? It helps you generate a question that aids the Pico format in the constructing the framework of the study and subsequently helping you develop a protocol. More defined population, the more stringent the inclusion and exclusion criteria, the greater the effect of interpretation and subsequently applicability and generalizability of the research findings. Study population. There are two types. You can have a restricted study population or a broad study population. If you go for a restricted study population study and exclusion criteria, it may limit bias in your study and increase the internal validity of your study. But however, it will limit external validity of the study because the sample size is small. Is it applicable to a bigger community? Thus, generalizability becomes the criteria. To wider population, it may represent clinical practices, but will increase bias and reduce internal validity of the study and of the point that you were trying to make. What is a poorly devised research question? And what impact does it have? It will affect the choice of study design, potentially lead to a futile situation where you will not get an outcome and your study will be negative. The quality of the study will be compromised if your quality of question is not good. So would the results. And it will hamper the chance of finding anything significant. And that means you might not only have missed, but you may misguide others who wanted to do the same work because now they won't be convinced. And it may potentially hinder publication. In What are some of the inaccuracies in formulating a research question? The lack of originality. The question is too broad, so you cannot come to a precise conclusion. It's not really feasible. It's time. It's very resource consuming. And you don't have the adequate knowledge to do it. So if I were to start off on bariatric surgery and now want to go and study the structure of bile, I have no prelude knowledge to this. I have never done studies how to do chemical analysis for bile. I have no expertise in it. I shouldn't be the one doing it. I should be collaborating with somebody to do it. And when the research question is not well justified. When we look at retrospective data is generally hypothesis generating, a question generating, and you work backwards to developing the question, and then you answer the question through a prospective study. The order of the day should be that you should be able to develop a research question which gives you a hypothesis. The hypothesis then determines sampling strategy and how you're going to position your interventions. When the outcomes are available for comparison, you will do the analysis and then you would reach a conclusion. The research objective defines the specific aim or the primary endpoint of the study. It helps you guide the development of the protocol. It plays a role in sample size calculation. Most people would say use a null hypothesis that the intervention is neither superior nor inferior because it leads to a decent sample size calculation. You can use the research objective to calculate the power of the study and in decision making in incorporating patient values and preferences. I've put here for you a simple checklist. Start. If you think about publishing, if you're thinking about research, start with a research question, make it a habit to read literature, think about topics that interest you, and then you say, well, these are the topics of interest that I want to study. And you want to write down a paper, narrow down from the topic an idea, area, and then do relevant literature searching. What you need to search now is, has this been published, already done? If it has not been, why has it not been? Why didn't somebody do it? Somebody must have thought about it. They might not have had the adequate resource, the time, or the population to do it. Is it interesting? Do I need to really, will the readers like it? Will the editors like it? Is it really relevant? Ask yourself, when you formulate a research question, is the question that I'm asking specific enough? Because then it will reduce bias and it will provide internal validity, as we just discussed. Its journal applicability may not be very wide, so we need to create a balance between them. Is it feasible in the allocated time? As I put an example, if we go for mortality, mortality takes a lifetime. If you do a study, prospective study for mortality, it may not even happen in your lifetime. You may not be able to conclude it. Do I have enough resources? Resources are not only financial money. Are you funded for it? In my part of the world, you need to pay patients for their time, for their surveys. You need to have research coordinators. Do I have manpower? Do I have collaborators? I want to look at changes in OAGB, in the gastric mucosa. Do I have somebody who can even do the work? Do I have the necessary knowledge? I want to compare mortality between bariatric surgery and usual care. Do I have in my team a statistician who can actually do this work for me? Do I have the knowledge of statistics if I want to do it myself to be able to complete this research question? Because I am the PI of the study. Well, with that, I would like to say thank you once again, a big congratulations for this inaugural session to Professor Pradeep Chobe, Kamal Mahaver, Raman Goel, and Aparna Bhaskar. Thank you very much for the kind invitation, and I would be very happy to take any questions that anybody may have at this juncture. Thank you very much for your kind listening, and have a great course ahead. It is really very useful, and I find these very useful for us to keep understanding how we should do basic research. Thank you very much, and look forward to your questions.
Thank you, Dr. Shabir. This was just what we were hoping for our first episode. A great way to start our program. We don't have any questions from the audience yet. I do see someone typing in the WhatsApp group. So in the meantime, can we move on to the next presentation? Dr. Shabir, will you be available for the next 20 or 30 minutes?
I will be there.
Thank you. For the next lecture, we have Dr. Kamal Mahaver, who is the co-editor of Journal of Bariatric Surgery. And he is an associate editor for Obesity Surgery, and he is on the editorial board for many more journals. Let's not spend any more time in introducing Dr. Mahaver, because we all know who he is, and start with his talk on what can I publish. Dr. Mahaver, over to you.
Yeah, thank you very much, Pallavi. I'm not sure if my slides are visible in slideshow mode.
Yes, they are visible in the slideshow mode now.
Okay, yeah, thank you. It's a tough act to follow Dr. Shabir, and I have to say, you know, he's covered it so eloquently and elegantly. I will struggle now to do my talk. For those who don't know me, my name is Kamal Mahaver. I'm a consultant surgeon in northeast of England, and I take a little bit of an academic interest in bariatric surgery. The topic that I've been assigned today is to talk about what can I publish. And I think now that Dr. Shabir has set the scene for this talk, I can really move on and build on that. So as Dr. Shabir has said, and I will not really dwell too much on this, what are the essentials if you want to be an academic surgeon or an academic bariatric surgeon? In my view, all you need is a desire to share, learn, and a questioning mind. And along with that, if you also have some good English language skills, they will help, but it's not really a must. You can always learn this thing. This refers to the point number one, desire to learn. A little bit of understanding of data and numbers is helpful. And your ability to look up and understand published literature, that's helpful. So I think these three things are desirable, but then they are not impossible to acquire, and anybody within a few months can develop these and acquire them without too much of an issue. What is definitely not a must is to have a large clinical practice or knowledge of lots of statistics and complex statistics, have lots of funding, or higher degrees. Obviously, these things don't harm if you have them or if you know them, but they are not a must. And if you don't have any or all of these, you mustn't be deterred in pursuit of your objective. The first thing I'd say is if you want to embark on the academic journey, is try to understand the literature. And these days, gone are the days when we used to go to libraries 25 years ago and use Index Medicus to find articles and spend hours and hours looking for those articles and then photocopy them and read them. Now, almost everything is available to you on your laptop. PubMed is a good place to keep track of literature. I would often go to PubMed, just type bariatric surgery and use a time field last 2 months, 3 months, and see what's been published in recent times. That you could do wherever you're getting bored and when you've got nothing to do. It's a great way to understand and keep track of the latest advances in literature. If you want to read articles full text, most of us, we have access to Obesity Surgery, which publishes the large number, the vast majority of literature in our field. You can also get access to SOD rather easily. And as Dr. Goel said, JBS is going to be open access anyway. In my view, questions come to your mind when you have a bit of an understanding of literature and you're constantly thinking about how to improve things for your patients. So the most important thing is to have a questioning mind and desire to improve the current situation for your patients. I think without that, you cannot become an academic surgeon. Academics are people who are constantly thinking how they can make things better for their patients and for themselves. And if you start thinking without having data, then I think the next step you should say to yourself is that, when I'm thinking about my patients or how to care for them, do I really have enough data to think about them, or am I just making things up? Because without data, you cannot think effectively. And that is where we're coming from today. And that is why we need to do academics. And that is why we need to engage with academics. Coming to what exactly you can publish, which almost everybody could do. And a very good friend of mine sent me a link to an article just this morning, said, we could write a comment on this article. It's been published in the Lancet. And these are great ways to start publishing. Even very accomplished, and this person is an accomplished academic surgeon, write comments and letters to the editors all the time. And this is a great way to get published rather easily, I would say, because if you have an important thing to say, or if you have an important comment to make, just pick up the paper or laptop in the current environment and just send something. Most editors want a debate around published stuff. They would not be stifling your voice, and I think you'll find, if you're making sense, you'll find a platform to express them. What else can you do? Most of us can rather easily do a survey. You need to know how to do a survey, and that will need some time, but I mean, equally, it's not rocket science. If I can do it, most people can do it. Learn how you'll reach your target audience. Survey is a great research methodology. I've sensed, from some quarters in the past, people used to say, oh, well, it's a survey. Well, survey companies are billion-dollar enterprises, not because survey is a poor research methodology. In fact, there are certain questions that can only be answered by a survey. For example, if you want to know what are the variations in practices in Roux-en-Y gastric bypass across the world, there is no other way to determine that apart from doing a survey. You could do any number of studies, but without doing a survey of global community, you would not know what are those variations. And without knowing the variations, how would you know what is the best practice? So I think, don't listen to people who think surveys are not good. Some really, really good quality surveys are even published in very, very high impact journals as well. And that is why these survey companies are there. You could also do a review. Pretty much anybody could review the literature. If you have a topic in mind where the literature or the answer is not very clear, and you want to find out the answer for yourself and for others, just look at the literature and say, once you've read 30 articles on the topic, you will feel like an expert on the topic. And then you want to write something down. You could do a narrative review, which means that you're just summarizing the thoughts in your own fashion. Many journals do not look very favorably at narrative reviews these days, but they're still very popular. And if you can summarize all of the literature, which can take hundreds of references sometimes, people will look at them. Or you could do a systematic review, in which case you systematically examine all the literature on that topic and then look at it. You could also do a meta-analysis. Doing a meta-analysis is not easy, but you can learn it. Most of us, would also need some help to do a meta-analysis, but there are free software these days. RevMen by Cochrane is free. And if you start using it, it's not that difficult to use. You'll struggle with the first few, and my advice would be to involve somebody who's already done a couple. But then, once you start, once you've done a few, then they can be rather easily done. And teaching is free these days. On YouTube and internet, you will find teaching for almost everything that you want to do. You can build a consensus on a topic. If there's too much variation on a topic, maybe you want to build a consensus. If everybody that you speak to is doing something different in any area of science or surgery that concerns your patients, maybe you say, look, we can't all be right. Let's find out where the majority of us lie. And a majority opinion generally tends to be the favorable one. I'm not saying that it is always the case, because that is why consensuses cannot replace evidence. Majority is not always right, but they are generally right. And it is better than the opinion of a single expert. So that is why consensus statements are very popular these days. And if you want to do consensus building, reach out to experts. I've done a few in my time. And if you write to experts and big surgeons who've got lots of experience, they are generally willing to help you. I have not found, rarely will people turn you down or say they haven't got time. Most people will make time for these things. And consensus statements are really favored by journals as well. You could pool data with others. Many of you know, last year, my good friend Rishi Singhal and I, we did a large international data collaborative with Geneva study. I think Rishi's last email was that he's published half a dozen papers already from that data. If you don't have your data of thousands of patients, which very few people have, to be honest, then you can combine data with others. And that actually improves confidence in findings. Multi-center data improves confidence in findings because it's not reliant on just one patient population or just one group of surgeons. It tells you across the board what's happening. And generally, people engage with these data pooling exercises because, they all get authorship. My view there is offer authorships liberally, but within the confines of ICMG criteria, obviously. Don't just give it for free. But don't be stingy about it, because it doesn't cost you anything to make somebody else a co-author as well if they're contributing and they meet the criteria. Then you could get access to large data. Now, in the UK, we have NBSR, which has been functioning for nearly a decade now. It was obviously set up by Richard Wellbone, and I'm on the NBSR committee for nearly 5 years now. My colleague and friend Peter Small chairs the committee. So we've had access to some data from there. I know OSSI in India is setting up its own registry, so they will have soon access to large data. If so, has its registries. So if you reach out to people, most registries have a mechanism for data sharing. There may be some cost involved, but it's not usually prohibitive. And also, they may be a form or two to fill. But generally, they are open to such requests. So they should be anyway. And at worst, the answer will be no. So do reach out to people if they have, and there are lots of such registries across the world these days who are keen to support researchers at every stage. The other thing that you could do is establish research priorities. We have done this with a good friend of mine called Michael Wilson. He used to he used to work with us in Sunderland almost a decade ago, and is now a consultant in Scotland. He's established research priorities in a number of clinical areas. We did that for COVID last year, establishing research priorities during COVID times. We did that for bariatric surgery a few years ago. So basically, what you do is you put together a group of people, professionals, patients, everybody, and you say, look, what are the key questions in our area? What are the questions that we would like to answer in the next 5-10 years? And that itself can be an exercise that you could publish. The other thing that you could do is establish core outcomes. For example, if you look at a bariatric surgery paper, and if it doesn't report, generally, most bariatric surgery papers would tend to report on weight loss and on complications and things at all. So with bariatric surgery, I think the Bariatric study, which was an offshoot of the Bioband sleeve trial in the UK, they established what are the core outcomes which every RCT or funded large study in bariatric surgery should aim to answer. Now, this goes slightly against the primary and secondary endpoint theory, because obviously, as Ashim was saying, research needs to be focused to be able to specifically answer the question. And if you have to answer a set of outcomes for every study, that becomes very difficult. But I think the underlying ethos is that, don't compromise your primary and secondary outcomes, but still try and answer a number of other key outcomes if possible, especially if you're doing a large funded RCT type of studies. You can write guidelines, and almost anybody can write guidelines if you have support of a society, and for example, internationally, if so APC or other groups, India or say UK guidelines, because the guidelines that are prepared by maybe somebody in the US may not apply to your patient groups. So you want to write up something that applies to your practice, your patients, and yourself. And once again, they're not impossible to write. You just need to put together a group of people who are interested, who have the time to devote to this exercise, and then here you go. And then you have a guideline. You can share learning, and when you have a problem, we all have problems from time to time. I have plenty of my own, and if you want to share that with others so that others don't have the same problem or others don't encounter it, then the best way to do that is to share it. Obviously, anonymize it, and then you can publish it as a case report or even a letter to the editor. And I know from Professor Chaube and Dr. Goyal that JBS will publish interesting case reports as well. So that is one way to do it, and start publishing. Other important area which is developing in terms of publishing these days is patient-reported outcomes. There's a big trend towards it in academic surgery, academics in the medical field across the board, really. So, generally we tend to collect outcomes, like, you collect what's your complication rate, you collect what's your, mortality, morbidity for any procedure or weight loss. When it comes to patient-reported outcomes, you don't collect a thing. Patients will report the outcomes, which means that we take out the intermediary, which is you. So generally, the philosophy is that if patients are reporting it, that will be more accurate because there'll be no bias. Patients will state the facts as they are. And I think in the world of bariatric surgery, there are very, very limited patient-reported outcomes. So you could start looking at that and you could start publishing them as well. Generally, it is considered a good thing these days to involve patients in research projects, in planning, and especially for large RCTs and all. Some journals even demand that. Finally, and I think we're coming to the end of my presentation, help others with their studies or projects, and then they'll be more likely to help you with yours. It goes both ways. You cannot expect others to help you if you don't help others in their endeavor. And if you're on social media, use it to build your network. Don't rely on it, because I see a lot of people say, look, social media doesn't work for me. Social media by itself wouldn't work for you. You have to back it up with emails and telephone and face-to-face networking. But social media is a great way to stay in touch with a large number of people who you cannot otherwise constantly engage with. That's just a few of my things. Really, if you involve people with experience in your projects and use their guidance or help or reputation in the beginning. When we start off, we don't always know everything. We can't know everything at the beginning. So what do? You complement your skill sets by involving people who have those skill sets that you're lacking. So let's say you don't have a great reputation in the field. So what you do is you tie up with a few people who do have a reputation in the field, who are willing to help you or guide you or mentor you. And you take their help in the first few projects. And after a couple of years, you are helping and guiding and mentoring others. This cycle goes on. And my advice would be that if you haven't explored this, maybe you try this, because this can be a relatively easier way to sort of develop things. I hope I've given you some ideas of what you can publish if you are new to the field. And I see many names here who are actually very, very advanced academics. And I think this talk will not apply to them. But I'm hoping there are one or two people here who probably would benefit from what I've said. With that, I'll conclude my talk. Thank you very much, Pallavi, for asking me to do this.
Thank you, Dr. Mahaver. I remember talking about this lecture when we were formulating our plan for this course, and thank you for bringing that vision to fruition. We are going to have a recording of this meeting on our website, and I think this episode with the first 3 lectures, this is going to be one of our most prized possessions there. We'll take the questions at the end, and we move on to our next speaker, Dr. Sandeep Agarwal. Dr. Sandeep Agarwal is a professor of surgical disciplines at AIIMS, and he is the current editor of JBS. He is also on the editorial board. He's also on the editorial board of Obesity Surgery, and he is an associated editor for JBS. So he's just the right guy to take us through the how of academic publishing. Over to you, Dr. Agarwal.
Yeah, thank you, Pallavi, and a very good evening to everyone. I'd like to thank Dr. Goyal and Dr. Chaube and Aparna for this opportunity to be among the the stalwarts for this very important course on publishing. And my topic is how to publish, and obviously that's the most difficult part. All of us know that. And I would maybe request a little extra time for you, so that I can drive through all the important points as far as my lecture is concerned. So converting a research, study into an article, it's not a rocket science, as everybody says, but it's not child's play either. It's a lot of hard work, I can tell you. An average original article can take, anywhere from 3 to 6 months from the time of writing to ultimate publication. It requires persistence and self-belief. And I can give my own example. My first article got rejected by 3 journals before finally being accepted in a better journal with a good impact factor. It requires honesty, and as Kamal said, a reasonable command over the language. For a research article, now it's important to assess your study. And decide what you want to say in an article. As Dr. Asim also said, the flow of the article and all that, you have to decide what you want to say. It has to be something new, something novel, and something original. And whatever you say must have a significant scientific value. And it must add to the existing knowledge rather than replicating it. For example, again, if I'll give some example of my own studies. This study, we, titled it that should surveillance endoscopy be routine after one anastomosis bypass to detect marginal ulcers. And in fact, so it sort of raised a question and answered it. And also, obviously, this was something which was novel and it was not routinely, studied. And hence, besides the data of the OAGB, this was the one thing we highlighted in this paper. Again, does your research results answer the research question you raised? And when you describe the research, can your results support a conclusion with greater global impact? And Dr. Asim referred to the finite criteria. I won't repeat that. Again, a bit of an example. When you say something, when you say a title, your aim and your conclusion, there should be something definite to say on that aim. And you cannot leave it really unanswered. So either you say it is safely performed or it is not safe to perform. And so ultimately, in a conclusion, you have to give a clear-cut answer to the question you raised in your study. I think the case report Dr. Kamal has covered. I would say we were taught that case report is the first thing to start as a writer. And having said that, I must also say that it's very difficult to get a case report published nowadays because most good journals do not accept. And luckily, Journal of Bariatric Surgery will be accepting case reports. But again, when you have to look at your case report, you should look at what is the novelty of your case. It could be a novel technique, a rare pathology, or a rare complication. So whenever you have something interesting, have a look at the literature. Is it novel? Is it new? And what you may think as a novel case report may not be as unique once you do a lit search. For example, supposing you have removed an intra-abdominal foreign body laparoscopically, and now you put foreign body and laparoscopic removal, you will get thousands of results. Here you can see 637 results. Obviously, this is not something unique unless it's a unique pathology or a unique way of removing it. So you have to have a look before you put in that effort to write the case report. So again, but for this, you must have all the imaging, all the pictures, all the histopathology. And if you can do a thorough review of literature along with that, it would be a very good addition. A lot of journals will start considering your case report, maybe as a letter to editor or as a case report, once you've done a thorough review of literature. This is just to, so this will be probably one of the first things to start because easy to write, can be done very fast in 2 or 3 days if you have all the material. So I would strongly encourage that you have something to write to, interesting, you can start with the case report. Now coming to writing an article, getting an article published, and I'll go into the steps of it. And just to say, it's like creating a story. And for that, one of the most important steps, obviously you've read the literature, done a literature search when you were conceiving the research idea or a research question or doing the research. But again, when you're writing the article, you have to do a thorough search of the literature again. In the time you did your research, there may be some more articles which have come in. I think the choosing an appropriate journal would be the first step to start with, when you start writing an article. And I would tell you why. Because, you have to, suppose you are a researcher who wants a quick publication. You don't have too much time. You are applying for a career job. You would look at a journal with a good, faster processing time. If you are an established researcher, you think your research is very good, you want a higher impact journal, you would look at that sort of a journal. You would also look at what are the types of articles which are accepted by the journal. So you must look at the journal or choose the journal before you actually start writing the proper article. And I would state very strongly. And also you look at whether you want an open access or a hybrid journal, whether the peer review is blinded or non-blinded, and also go through some of the articles of the journal. So you know the style of the writing, you look at the readership of the journal, whether your article is suitable for readership of the journal, because one of the most common reasons for rejection is that when your article is not of interest to readers of the journal. So you must look at that part about us, about the journal scope. And there are tools to look at where is, how to find a journal. I won't go into details of that. For example, SWOT, if you have a surgically oriented article in bariatric surgery, if you look at the scope of the journal, it says it looks at articles with highest quality with techniques of treatment of severe obesity. It documents the effects of surgically induced weight loss and obesity. But now if you have a look at the article, let's say, on, let's say, training opportunities and, or let's say, how to do survey for obese people or something like that, maybe this journal would be better, which it's a broader scope. It looks at not only surgical part, but also the medical part, the pharmacological part, psychological aspects. So you have to really look at the type of journal and choose that journal based on what you are planning to write. Again, look at JBS. I mean, if you can look at the types of articles accepting. So you can put your article as an unusual case, or if you are doing it differently, then how I do it differently. It's got a separate section on instruments and equipment. So all this is very important when you're planning to publish your research. Again, as I said, the time to publication. I think obesity, this is from obesity surgery. This is probably one of the fastest times from submission to publication. And in spite of having a very good impact factor, most of the good impact factors take a lot of time, but this journal really fast from the time of submission. So again, you have to look at what you are aiming at. But again, beware of predatory journals. Don't go for a journal who charges publication fee, who do not indulge in peer review, who are just falsifying their impact factors. And there are a host of them, and please don't fall prey to them. If you put in your CV, a publication in a predatory journal, it's a negative for your job prospects. Now, coming to how to write an article, and all of us are well aware of this MRAT concept. The introduction, that is why the research, methods, what and how we have done it, results, what was found, and discussion, answer, is it answering the research question? And I think one of the most important steps is to write the introduction. It should be brief. It should just roughly divide into 4 parts. What is already known about that particular problem? What is the gap in evidence? What are the limitations? One second, just not able to get this out. So what are the limitations of the previous studies based on a literature search? What is the gap in evidence, and how do you propose to fill this gap? That is a methodology. And this is, sorry, it's not moving. Yeah, this is just an example. Again, I've taken our own study because I'm familiar with them. So what is known? For example, this study on GRD after sleeve gastrectomy using various investigations. And so what is known is that obese patients have an increased prevalence of reflux. The gap in knowledge is we do not know what is the impact of sleeve on reflux. And why do we care? Because we know sleeve is a popular procedure. And if GERD is a significant problem, should we modify it, a technique or something else? And how do we fill this gap? Is doing certain investigations like symptom scoring, GI endoscopy. So this is the way, a short, concise introduction, just thinking in your mind, what are these, are we able to answer these 4 points? Methods. No, in methods, again, you have to describe the study design, the ethical approval or approval for any questionnaires used, the methodology in detail. The method should be in so much detail that any researcher should be able to repeat the study without talking to you and without even looking at elsewhere. So everything should be there. Even if you use some equipment or some reagent, then company making the reagent in the city and all that should be there so that they can directly get it. Details, at least a brief detail of operative procedure, although it's all right if you have published it earlier and you are doing something, some other publication, you can give a reference to the previously published study saying that it has been mentioned there. If you're using follow-up method, the intervals, the investigation use, all these things should be there in reasonable amount of detail so that anybody can replicate the study. So sometimes what is a faulty study design? You have an unclear research question, you have wrong inclusion criteria or population base, you use a wrong comparative group or a control group, you use methods which cannot be repeated, or you use a faulty calculation of sample size, faulty stats, all these you have to sort of look into before you start thinking of writing an article. Again, when you say results, you should mention all the results, including the demographic data. It should have results pertaining to primary objectives as well as secondary objectives. I've seen several articles, they give a lot of things in the methods, and when it comes to results, they omit certain objectives which they're supposed to address. And it's always a good idea to include results on complications, especially articles in bariatric surgery, because a lot of reviewers want to know, yes, you have said this is efficacious, but does this have increased complications? So it's always a good idea to have something on the complications part. Use tables and figures appropriately. Don't overuse them. And mention the number of patients at each follow-up in the table. Coming to figures and table, they are one of the most efficient ways to present the results. Number them properly as they're cited in the results. I think one of the most important things is to have the captions, the legends must be standalone. Okay, so if I see a table and I see the legend, I need not be referring to the text to understand the figure or the table. It should be detailed enough to make figures and tables self-explanatory. And another important point is it should not repeat the results presented in the text. So if you say the mean age of the patient was 45 years, BMI was 50 in the text, and again make a table saying the same thing, it's really a waste of words and waste of space. Coming to discussion, I think this is where most people go wrong. Discussion should be written after a thorough review of literature. I'll come to that part. It is not a repetition of an introduction. A lot of people write discussion starting with the same language as the introduction. I think the good discussion starts with your primary result. What result have you obtained? The incidence of marginal ulcers in our study was 12%. And then you discuss it with respect to the literature. What other people have to say? What is the reasons for your incidence? Why is it not corroborating with the world literature? Or why is it corroborating? And any discrepancy in the results should be given an explanation. Any statement which is not a part of the study should be given a reference. You discuss all the important findings. Don't try to hide some findings which are negative. They are equally important, and try to give an explanation for any unexpected results. And don't discuss in detail anything which you haven't studied. I saw a paper where it was about hypothyroidism after bariatric surgery, and that kept discussing the basic physiology of thyroid and then TSH and T4 and T3. The first 6 paragraphs were just on this, and obviously you lose interest when you, as a reviewer, so don't discuss in detail anything which you haven't studied. You just can't copy it from somewhere, some book, and put it there. And I think I won't go into that how to do a lit review. When you're writing a paper, I know you have done your lit search during your study designing, but then again at the time of writing, it's extremely important to go through the fresh literature. And how I do it, or I tell my resident to do it, take out first at least 5 latest most important articles related to your study. And don't limit yourself to just review articles. That's a common mistake. Somebody picks up one review article, writes a whole, that's not done. Read word by word these 5 articles, highlight the important points, make notes, read their discussion section most carefully, because that's where you know what needs to be emphasized, what needs to be discussed. Look at the cross references and take out another 5 articles. And I make a folder of all these articles right at the beginning. For example, just give you an example. So this, I had to write a chapter on marginal ulcer. So this is how I go about things, highlighting the important points which I have to relook. And don't copy from these. So I'll talk about plagiarism a little later. So poor quality discussion would be a repetition of introduction results. That's one common mistake. Only certain aspects of literature are discussed, and you choose to ignore what is not suiting your study. Okay, so you may say, you may quote literature which is supporting your study, but not quote literature which is not quoting and I can tell you reviewers are very smart people. They know their experts. They know what is there in the literature. And all the results have not been discussed. You have not explained. There are contradictions. So all these things are again very important from the point of view of discussion. So discussion is one of the most important part, of the article. Coming to conclusions. Don't make too many conclusions. There should be few. They should be justified by the results. And sometimes I've seen authors saying something in the discussion and exactly opposite in the conclusion. I'll give you some examples. Okay. So in a study, again, all these are real studies, and I'm sort of anonymized them. Impact of robotics in learning, RYGB. The authors mentioned 3 leaks, 5 bleeds, just requiring transfusions, and 1 mortality in 80 cases. And yet in conclusions, authors state robotic technique is safe in their hands. So how sort of ironical it is that with so many complications, and we all know bariatric surgery is such a safe thing. Again, 3 of the 30 cases had bile leak using ICG during lab poly. while 5 had bile without use of ICG. ICG is beneficial in decreasing the bile. Again, very small sample size. How do you say such an important, profound statement? Again, there was a last study from a country, which said our mortality rate of 0.9% is in line with the global standards. And in discussion, they discussed the literature that global best centers have a mortality rate of 0.1% or less. So how does 0.1% compare with 0.9%? Again, a wrong conclusion. So I'm just giving you real examples to show how not to put your conclusions. Say what you have found out in the results. References, all of us know they have to be correct. This is one of the first things most of the reviewers or even the editor looks at, or even the technical team looks at. And if there's something wrong, they will straight away send it back to you. What about cover letter? Is it a formality? Is it just something to be ticked? I think it's not just a formality. It should convey the brief key aspects of research, and it introduces your work to the editor. You should mention the type of manuscript and a little bit about the study. Highlight why this work is novel or why should it get published. And I think more importantly, while it will be of interest to the readers, because one of the key decisions editors have to take is whether this work will be of interest to its readers or not. And should have all other information in the last paragraph, which the journal wants. But I think it is just not what a formality. It's just you have to really look at and make the editors, because it raises the interest of the editor in your article. Decide on authorship. Authorship, again, Kamal has talked about a little bit, but there are certain ICGM, the guidelines by various international organizations, that an authorship should fulfill all these criteria. Substantial contribution to the conception and design, data acquisition or analysis or interpretation. They have to be accountable to all the aspects of the work, and all the authors should approve the final version. Okay, so these are the criteria one must be met. It's not always right to put your HOD or a chairman of the department just because the chairman is not participated in the study. That's not right. But if somebody has contributed, please don't poach the credit. As Kamal said, always use them, put them as a co-author. Again, so authorship I've talked. What are absolute don'ts? Fabrication. Don't make up research data. If you have done study on 50 cases, don't make it 100. Don't manipulate any existing research data. Don't misquote the papers. Another problem is misquoting the existing literature, picking up certain paragraphs which are relevant to your study, but not showing what is, showing the opposite. Again, plagiarism, again, is a big topic in itself. All of us know it should not be done. It may be plagiarism of words, paragraphs, ideas, pictures, figures. So it's not to be done. Anything you cite, the cited part has to be in your own words. Don't even just copy. Even if you cite the reference article, you can't just copy from that article and paste it there. I think the best way I tell my residents is read the articles you want to cite, take a coffee break, write down the part you want to cite from memory. You will never repeat those words. It's a very simple tip to avoid this. I won't talk about salami slicing. I think we are really going in out of time. Declare a conflicts of interest, which the journal wants. Do a checklist. This is a checklist from JBS. Take it, see every point. Don't mean a rush to submit. Just check every point that it's there. Follow the instruction to author strictly and be honest in that. Just a word about, I think overall in a good writing, you create a story which has a logical flow from one idea to the next. There shouldn't be a discordance of the ideas. You jump from one idea to the next. Don't use too many words. In fact, when you reread it, try to reduce the number of words, be concise. Any important statement that is not the direct result of study should have a reference. I would skip this. I would just say if you should be aware of the process to publication. Whenever you submit a manuscript, goes through a technical review where the technical editor checks the requirements of the journal. And then it goes to the editor who looks at whether it's worth taking it to the peer review. And at the outset, I think some of the journals reject 1/3 of the articles because they do not conform to a lot of ideas that the editor has in his mind. And from peer review, it can come to revision or rejection or acceptance, and all these other categories of final decision. And most journals, good journals, would have a 30 to 50% rejection rate. So don't be disheartened. And I would just say, why do they get rejected? As I said, all the requirements of the journal should be fulfilled. There are mistakes at several levels which are picked up. You may not realize it. You can have incomplete figures, incomplete sections, poorly formatted references are one of the commonest area of errors. I won't go into examples of these again for the lack of time. These are just the common reasons for rejection. Maybe my reasons or any other editors. If an article is too complicated for an average reader to comprehend, let's say it's an MRI, something of spine in bariatric surgery or scar sarcopenia, you're going on describing the MRI findings, T1, T2. It's too complicated for a reader of a bariatric or a bariatric surgeon to comprehend. A faulty study design, extremely poor English and grammar, or too many repetitions, deliberate omission of facts or misrepresentation of facts in literature, and an editor can come to just in reading it for 10 minutes, And if there is a mismatch between results and interpretation, I showed you some examples. There's a poorly written discussion with inadequate review of pertinent literature, omitting discussion of crucial results. You don't want to discuss the complication maybe. You've just shown the good things, and somewhere in the table there is a point saying leak of 5%, you've not discussed it. Poor clinical relevance, combination of all these factors leading to a poor overall quality. So these are the things which lead to rejection. So when you are submitting an article, check for formatting, check for any incomplete sections, be up to date in your references in field of study, cite latest references, emphasize on the practical applicability of study, deliver a clear message, be honest, and let your manuscript be judged based on scientific content and merit rather than avoidable mistakes. You make mistakes, in spite of being a good scientific manuscript or a study, it may get rejected because the English was too poor, or you've been too casual in submission. Remember, rejection is more of a norm. Don't get frustrated. I told you my first article got rejected thrice before it got accepted. Take a break when you get a rejection. You may think journal is biased. Somewhere you may be frustrated because you put in a lot of hard work. Believe me, all of us editors, we know how hard it is to submit a manuscript. We do not reject it just like that. Take a break. Don't see it for a week. Then cool down and start seeing the comments in an objective manner. Improve your manuscript and plan for another journal. So go ahead, put your best foot forward and leave the rest to God. Happy writing. Thank you. Thanks.
Thank you, Dr. Agarwal. We did give you the most difficult part of the session, and I mean, it couldn't have been covered better. The entire journey from the writing to publishing is very frustrating, and it helps immensely if we have a roadmap like you just sketched for us. We will start with questions and answers. We do have a few questions coming in. The first question is for Dr. Asim Shabir. Is novelty really a very important criteria for a research question? We see this a lot in postgrad and undergrad research. This has already been done before, so I can't probably pick this research question. Should that deter people from picking up a research topic?
Okay, so research question, what is novelty to you? How do you define something which is novel? The common understanding of something which is novel is something which is brand new, which was never described. Is that novelty? But what is novel in UK or what is written in UK may still be novel in the Indian context, may still be very novel in the multi-Asian ethnic group that I stay in. So isn't it still novel? It may, within the country itself, be novel to different classes of people, right? So OAGB is not novel, but neither is vegetarian diet novel. But there is a lot of difference between Chinese vegetarian, which is based on soya protein, and Indian vegetarian. They are vegetarians. You have your own novelty. So novelty is something to me that has not been described that would add to the knowledge that is available in literature so that you can positively drive a thought process. That's what novelty to me is not, I mean, there are just that many questions we can ask and those many novel ideas we can come up with. But everything in our own domains is otherwise also novel to me. Thank you.
Thank you, Dr. Shabi, for clearing that up. I have the next question for Dr. Mahaver. It's from Dr. Samuel. He's asking, how would you advise any starter with an interest to pursue and publish in a field where there is no practice locally? For example, if there is no bariatric practice, but I still want to do a bariatric research, how do I go about it?
Yeah, thank you. It's a great question. So let's not put the horse before the cart. The purpose of the research is to answer questions for your patients. So if you don't have any bariatric surgery patients, who are you trying to answer the questions for? That's my first question. Maybe you have an academic interest in it and you want to later on go and work in the area and you want to develop credentials for that purpose. That's okay. For that, refer to my points when I said you don't need a large bariatric practice. To be honest, there are at least 10 things that you could do right sitting on your computer as long as you have a desire to learn about the field and engage with the academics in that area. For example, currently I am supervising 3 different groups of medical students, one in Syria, one in England, and one in Italy, writing systematic reviews on different aspects of bariatric surgery. So all I'm saying is that these people do not have any patient base there in their practice. They're medical students between 3rd to 5th year, and they're doing academic work. So often what you need to do academic work is just a desire and find the connections to do it. But equally, don't forget that all academic work has to serve a purpose in the end, and the purpose has to be the patient care. That's why we all do it. That's my take on it, Pallavi.
Thank you, Dr. Mahaver. We have one more question from Dr. Digvijay Bedi. It's good to see you here, sir. He is asking, he has been trying to do research by going through journals and find a topic that interests him, and then trying to see if he can do a research in that field. So this question is for Dr. Agarwal. He is asking if this is a reverse way of going about it, or there is something appropriate about it.
Again, I think it's a very important and very, very nice question. As I said, just my talk was about publishing, but even as a designing a research, I think first of all, you have to look at the literature, and you're absolutely right, going through the publications. And obviously as a surgeon, what are the hot topics, okay? So as a bariatric surgeon, it's the GERD in sleeve or a NAFLD or marginal ulcers. So these are the common things which need, and from the literature, you can make out what sort of track you require, what sort of further study required. I can just show you a slide which I had sort of deleted because of lack of time. So it's very important that you go, that's the correct approach actually. So if you list few topics first, don't look at blanket all the research. It's very impossible to look at that. You say, okay, my patients are like this, I'm facing this problem, let's say of marginal ulcer. And then you look at literature, see where is the lacunae, what from investigation point of view, from evaluation point of view, and I'm sure there are knowledge gaps in some of these hot topics, and so that's how you sort of go about these things. So I'll just show you one slide if you can give me a minute.
Yes,
to
sir,
show the importance of literature search. Just one sec. So I would say it's important to be absolutely thorough in the topics. So let's say this slide, I would just put it for you. And one sec. Can I share my screen for a while? Okay. And right. This is the one I would probably wanted to share. So look at this one, okay? So now if you do a lit search, this study was a very good study, and I had sort of reviewed for a project as a member of an ethical committee. And I was very impressed by the way they wrote the review of literature and raised the question. So now this study, when they looked at the literature, they saw that the comparative arm was wrong, whatever the previous literature was. So they compared the intravesical gemcitabine with saline irrigation, not with other chemotherapic agents. I'm just giving an example. So once you go into the depth of literature, you can find what is missing, and that's how you come with a research idea. So I think for coming up with a good research idea, a thorough reading word by word of the relevant literature is a must, and you're right in doing it. Just that you have to be very focused on few topics, not like a broad, you just go through 10 articles, not like that. Select few topics, go through it. As I said, 5 articles and 5 more articles. And I'm sure discuss with your colleagues, look at whether you have the numbers to do that research, and that's how you create a research, study. I hope I've answered the question.
Thank you, Dr. Agarwal. I think that was very clear.
Dr. Pallavi, can I, because there's no raise hand option here. So I think to all the 3 speakers, this is, I think, a very relevant question that Dr. Bedi has raised. A large number of surgeons in private practice in India, and all 3 of you know the work, how it works in India, are struggling to publish. They have an intention to publish, and they don't know how, and some of them may be doing a decent volume of work also. And many of them are maintaining their data, but they don't know what is the next step. Today, all of you have given a guideline, but can it be simplified for somebody who wants to take a first step? I mean, obviously reading a literature, as Dr. Sandeep is saying, is so important. But is data that a person has got in Ahmedabad or in Mumbai or in a smaller city enough to start? Can somebody say outcomes of gastric bypass in Gujarat or in Ahmedabad, and publish his outcomes? Is that a good study? Any one of you, please go ahead.
Kamal, you want to go first? Or Sandeep? Sandeep, go ahead.
No, please, Asim, you can go ahead.
Yeah. Go ahead, Sandeep.
So, what you said was precisely I was saying, that you have to say, yes, outcomes from a study, let's say bariatric surgery in Gujarat. So now you have to look at the other similar published studies. So suppose you have studies in, let's say, about obesity surgery or so on. Now they have studies looking at large Michigan database, lakhs of patients, this, that. So it's unlikely that it will get published unless you have something new to say. So let's say your study may say that our RYGB patients have a higher rate of iron deficiency anemia in spite of, I'm just giving a very crude example. So if you have something to say based on that outcome, just general outcomes, excess weight of 70%, diabetes resolution of 80% will not really gel, with the editor of these 2 journals. Again, this may come onto a journal which is actually, a little lower in the impact factor, a little less popular, or maybe other surgical journals which are regional in nature. But if it has something unique to say from your outcomes, if you look at your outcomes, say, okay, something novel which is not been reported or been less reported, I would say, yes, why not? But then be prepared. So look at some of that and then obviously choose your journal appropriately. Don't aim for annals or obesity surgery or so on. I would say that.
So Sandeep, would like how Asim was saying, that vegetarianism and a procedure. So somebody can say, what is the impact of vegetarian diet in OAGB versus RYGB? Exactly. And that kind of studies, you don't need to look at rocket science to formulate a rocket
science. Simple things, but something new to say. Something which is at least not absolutely like out of the world, but something which has not been published, not known to most of the readers. I would say that.
So Asim, how can you simplify a research question in the way that Dr. Bedi is asking? Because he represents majority of the surgeons in India who are in private practice. Not many are privileged to work in institutes.
Okay, so I think there are 2 parts of this. First of all, in today's world where data sharing is so common, there are places for, let's put up studies into big classes. There would be those retrospective studies where you keep collecting data. And as I said, they are hypothesis generating. The chances you will get them to be published in high impact journals is low. I totally agree with Sandeep that you need to then bring your expectations to par where you're going to put this paper at. Right? You can't ask for a 50 patient retrospective data coming from Gujarat to be published in SWORD when somebody from another institution has published on the same topic 1,000 patients, right? So you bring your expectations down. The second thing is, in today's world, there is a lot of collaborative efforts that are ongoing. And that's why you have OSSI. And that's why you should think about a question. Maybe within your state of Gujarat itself, you should work with like-minded people, ask a simple question, basically pool in your efforts and answer that one question, share the publication, you're on your way to publish. I give you a very good example. The Dutch publish on gastric cancer, left, right, and center. Randomized controlled trials. And the number of patients they have is handful as compared to Asia, right? But they're able to publish randomized controlled trials. How do they do this? They do this through collaborative effort, right? They come up, one bright chap in an institution comes up with a question and says, guys, are you on board? Just like Kamal does, you know, are you guys on board? Come, let's put our hands together and let's go and do this, right? And this is what we need back there as well, that we need to put hands together to ask the right question, and absolutely right. It has to be a simple question and everybody can contribute and you can pull in data.
Wonderful.
That's how I would do it.
Yeah. So my next question would be to Kamal. Kamal, is it a good idea to start with joining with some in a collaborative effort, or to have mentor in research? So, you know, I was one of those whom you referred as the quarters who were skeptic about your surveys initially, and I ended up joining you for multiple studies. So how important it is for somebody who is in a private practice to get a feel of research by joining a collaborative effort and to see different steps before you think of a RCT or a very technically challenging way of doing a research.
Yeah, thank you, Raman. And look, we all live and learn, Raman. And it's been naive for me to say that I have understood everything, you know, standing here. I think it's a journey, and I may be one step ahead of many of my friends here. But you know, I'm also, you know, taking the same journey as others are. And my view is that if you want to do it alone, I think you will be able to do it alone. Nothing is impossible in the world. It will take you longer. It will be less fun. You'll feel very lonely. You'll have those depressing moments when you'll have nobody, no shoulder to cry on. You know, and Rishi is here, you know, and he knows we talk almost daily about these things. It's a lot more fun when you have friends and you're working together with sort of, you know, sense of purpose. If you haven't done it before, I would suggest find a mentor and engage with them. Most mentors would work with you if they find that you are working hard. I find dozens of people from around the world approaching me who expect me to do it for them. That's not going to happen. You know, obviously I wasn't born yesterday, and I can sense these people a mile off. You know, and if they expect me to do the work for them, that's not going to happen. But if they're looking for me to help and guide them and mentor them, I'm available. Similarly, collaborating. I would again suggest that rather than going it alone, if you collaborate, you're more likely to be successful. But academically speaking, it improves the confidence in your data findings. Let's say you're going to report complications in your center. Yes, you may be accurate about your center, but people who want to know, patients who want to know about bariatric surgery, they want to know what is the complication rate of bariatric surgery in India. Of course, they want to know about your center, but generally when they're thinking about these things, they may not come to you or just one surgeon. If they see 15, 20 centers data, it improves confidence in findings. And also, you know, somebody will find out some flaw with this study design, point it out. Others will find something else. And generally, when there are 20 people working together, you get to the right place. So my advice would be, yes, find a mentor. Yes, collaborate with people, not just in the beginning, but throughout.
Thank you. Do you want to add anything, Sandeep or Asim?
Yeah. One point which I don't know, you may not agree. I think whenever we talk about collaborative projects and big research manuscripts, I think it's better to start the case report. Any surgeon who has a reasonable practice would see something interesting in his career. I would say maybe once a year he would see something which is worth considering reporting. And the idea of, again, that inquisitiveness. So once you see that, you do a search, then you work hard on it. And I can tell you, if you work hard on it, It may not get published in the first journal. It may get published in another journal. And I'll tell you, again, from personal example, it's not to, glorify myself. And I was a resident, we encountered a phrenic nerve palsy in a patient with pediatric transplant. The diaphragm was raised and nobody knew why it was happening. We just did a literature search and we found phrenic nerve palsy can occur after chronic subclavian catheterization. And this is how we latched onto the idea and we published it. I'm just saying, so when you see something interesting, and any person with a reasonable practice would see something, which is out of the, place, some, unusual tumor, unusual location, unusual pathology, I'm sure. And first step into my mind, and I tell to all my trainees, is start with a case report. You learn how to write it actually. To write original research article is not easy. To write a discussion for results, case report is easy. You know the case, you have to discuss with respect to literature. Maybe there are 8 more case reports, make a table, do a nice discussion, and I'm sure you will get it published, maybe not in a very, very high impact, but a reasonably good journal. So this is my advice to people who are interested in scientific writing, and then go on from step on, maybe write 3-4 case reports, then write a small case series, and then go on to collaborative research. Because even for collaborative research, I think people take on people who have reasonably, good standing academics, unless it's a survey.
Okay. All right. Before I hand it over to Pallavi once again, a little in defense of our new journal. I think there is a lot of discussion about good quality journal, index journals, high impact factor. But let me tell you with my own example that if you are publishing something, it is out there in the world. So if you have published something which is different and somebody is looking for it, it will come first on the Google search. So irrespective of whether you have published it in a very high impact journal or a low impact journal. So we will definitely have a program where we are going to talk of in detail what Sandeep has mentioned briefly today, in one or two slides about how to choose a journal. And one thing that has been told to me by Kamal is that whenever the journal gets indexed, all the articles which have been published before indexing automatically get indexed. And index and a high impact factor are more for people who are working in an academic environment, because you are not applying for a job based on the impact factor of the journal where you published. So I think that is just to defend that a new journal that you have started, and we definitely are looking for good quality manuscripts. Pallavi, over to you.
Thank you, Dr. Goyal. So just one observation before I hand it over to our president, Dr. Manish Khaitan. For the entire duration of 3 lectures, we had 0 attrition. People who joined in stayed in. So that says something about our first program. Thank you to all our speakers and all our listeners. And with that, we have Dr. Manish Khaitan here, president of OSSI. Dr. Khaitan, can you please take it for the vote of thanks?
Thank you, Ghosh. What a session. Right person, right convener, I would say. Right speakers. And I have always believed knowledge is all about sharing.